In this video, we will talk about methods that you can use to help manage the common symptom of urinary incontinence that can happen after surgery to remove the prostate gland. Pelvic floor training can help improve this issue. But first, a few tips about care after your surgery. Immediately after your surgery, you will be sent home with a urinary catheter in place. This is often removed at the follow-up visit with your surgeon, usually 5 to 7 days after your surgery. You may take a shower 2 days after surgery unless you have a drain in one of your incisions. Do not scrub the incisions, just let soap and water run over them and gently pat them dry. Do not apply any creams or ointments to your incisions. It is important to take any medications that have been prescribed by your surgeon. Please contact your surgeon if you have medication-related questions or if you decide to stop taking a medication. Urinary leakage or incontinence symptoms are common after surgery to remove your prostate gland. This leakage is usually worse right after the urinary catheter is removed and will gradually improve over time. Often, the leakage worsens at night and improves during the day. The pelvic floor muscles help to prevent leakage by tightening around the urethra, the tube that empties urine from your bladder. Your prostate gland gives structural support to the urethra. Now that this gland has been removed, the pelvic floor needs to work a little harder than it did before to prevent urinary leakage. Good pelvic floor strength is needed to help prevent urinary leakage after surgery. Learning how to perform a contraction or tightening of your pelvic floor muscles, also known as a Kegel exercise, can prevent leakage and strengthen your muscles. It is helpful to start these strengthening exercises before your surgery. Learning how to properly activate the pelvic floor muscles before surgery helps with proper use of these muscles afterwards. Please watch the pelvic floor strengthening video series to learn how to properly locate and strengthen your pelvic floor muscles. Urinary leakage is common after surgery to remove your prostate gland. Please be prepared by purchasing supplies before your surgery. Adult male protective diapers, briefs, or pads designed for urinary leakage are helpful to have ready for use. Menstrual pads do not provide the same protection as pads designed for urinary leakage because they are made from different materials. Please be sure to purchase protective briefs or pads made for urine leakage. Some patients find it helpful to wear a pad inside a brief. The pad can then be changed easily as needed throughout the day, and the brief is available if protection for larger leakages is needed. For smaller amounts of leakage, you may be able to use washable, reusable briefs or underwear designed to absorb urinary leakage. In general, we recommend wearing the least amount of protection needed. You may wear some kind of protection overnight, but after 3 dry nights in a row, you may stop using protective garments. During the day, while at home, try to avoid using protection, but as needed, wear protection when leaving the house. If you have urinary leakage, you may feel like you want to empty your bladder more often. Please keep in mind that this may not be a typical bladder urge, but more a desire to avoid leaks. As the leakage improves, try to keep a normal urination schedule, which is every 2 to 4 hours during the day and 0 to 1 time at night. Be sure to watch our video on urge suppression for tips on managing your urge to urinate often. Generally, we recommend that you drink about 6 to 8 glasses of water a day, with 8 ounces of water in each glass. But this can vary based on several things, including your weight, temperature, activity level, and medical conditions. Please speak to your primary care doctor on guidelines on how much you should be drinking. It is common to have constipation after a major surgery. Constipation can affect urinary leakage as well. It is important to control the pressures around the organs in your pelvis, including your rectum and bladder. Straining with a bowel movement is not healthy for your organs, and the extra pressure can increase your leakage, affect your blood pressure, and cause or worsen hemorrhoids. Please be sure to speak with your surgeon about dietary supplements, laxatives, and stool softeners to prevent constipation after your surgery. One of the best ways to manage constipation is to eat a healthy, well-balanced diet. Eating enough fiber will help reduce constipation. You may have a reduced appetite after surgery for 2 to 3 weeks. This is normal. Movement is vital for recovery after a major surgery. A gentle walking program is a great way to start. After surgery, please begin with short daily walks of 5 to 10 minutes per day and work up to 30 minutes, 5 to 7 days per week. We recommend starting these walks the evening after your surgery. Take a brief walk about once an hour for 5 to 10 minutes every hour during the day. Other than sleeping overnight, you should avoid sitting or lying down for more than an hour at a time during the day. You should also avoid lifting anything greater than 15 pounds for the first 4 weeks after surgery. If you have followed these recommendations and exercises, but urinary leakage continues beyond 6 to 8 weeks after your surgery, you may be a candidate for more individualized instruction with a pelvic floor physical therapist. Please talk to your surgeon about a possible referral to pelvic floor physical therapy.